Alright guys, welcome to this channel again. I remain Apoti Eri Olua, your favorite channel, and today we'll be looking at prostate cancer. That's it there. Alright, prostate cancer. What is prostate cancer? Now, before I talked about the prostate cancer, I'll be looking at the concept itself generally, cancer. Cancer is now a ravaging group of diseases globally. And what is cancer? Cancer are a group of diseases in which or whereby group of body cells they tend to grow and divide uncontrollably and abnormally. Eventually, the uncontrolled tissue they invade any tissue and destroy it. So in the process, they tend to form lump or something solid that looks like stonish, which is called tumor medically. So some others usually spread to nearby organs. It depends on the time it was detected. If it's detected early enough, there won't be spread. And the spread of cancerous cells to nearby organs is known as metastasis. I will mean. All right. So today we'll be looking at prostate cancer. Having known the meaning of prostate cancer, having known the meaning of cancer, prostate cancer is now the cancer of the prostate gland. And what is the prostate gland? The prostate gland is an accessory organ of male reproductive organ. Okay, the prostate gland helps to secrete a fluid that helps to protect the semen, that helps to protect the sperm being produced during sexual intercourse. Okay, now we've seen the meaning of cancer. We are looking at the meaning of prostate cancer. Now, what are the signs and symptoms of prostate cancer? At the early stage, you barely feel anything when it comes to prostate cancer. Yes. So these are some of the signs and symptoms of prostate cancer. Yeah, the first one is a painful maturation, which is known as dysuria, which means that whenever you're passing urine, you'll be feeling pain. Yeah, sometimes you might confuse it with urinary tract infection, which is normal. When you have urinary tract infection, you also have pain when urinating. And that is why, as from age 40, whatever you feel in your system, you need to report to your healthcare professionals, your healthcare givers, so that they can screen you and check you early enough to be sure of what is wrong with you in order to salvage your life. Furthermore, with the signs and symptoms of prostate cancer, we've got erection dysfunction, erectile dysfunction, in which you won't be able to perform very well sexually. Then we have hematuria, which is known as blood in urine. Hematuria, erectile dysfunction, painful micturition, dribbling of urine out of the bladder, and then most times retention. When you have the urge to urinate, urine is accumulated in your bladder and you can't pass it out because the prostate are swollen. When the prostate is usually affected, they tend to swell, and the urethra that conveys urine from the bladder through the phallus outside the body usually pass beneath the prostate gland. So whenever the prostate is affected, either through benign prostatic hyperplasia or prostate cancer, they tend to swell and then constrict on the tubings, thereby making it difficult for urine to flow out easily through the urethra. You get it? So that is that about the signs and symptoms of prostate cancer. Now, looking at the diagnosis of prostate cancer. Diagnosis can be made in 4 different ways. The first ones are the signs and symptoms, which I have talked about. The second one is your blood test. Your blood test majorly has to do with your prostate specific antigen, and it's usually between 0 to 4. So when it's high, up to like 100, 50, 80, yeah, it's pointing to a more virulent prostate tumor. Okay, so the third one is imaging. Ultrasound scanning, the commonest one, which is the ultrasound scanning, CT scan, MRI scanning, can also be ordered to see spread, the extent of spread, metastasis, or the extent of damage of prostate itself. All right, and the fourth one is biopsy. This is a procedure in which some tissues of the affected body organs will be taken out and taken to the laboratory for histopathologists to study and see if the tissues are intact or have been affected abnormally. That is that about the diagnosis of the prostate cancer. And now this is going to lead us to something more interesting, which is the epidemiology. Now, looking at the epidemiology, the usual onset of prostate cancer is 40 years old. When you are 40 years old, prostate cancer can decide to come up. All right. Average 1.2 million cases of prostate cancer are being diagnosed every year, which means that 1 million plus are developing this prostate cancer every year, and this is common in men. It is men are mostly affected because men mostly possess prostate gland. You can't find it in women except for the transgender women, which you can hardly see around. I've never seen anyone around. So men are often coming down with prostate cancer, and that is why every year numbers of 1.2 million cases are being diagnosed. Now, out of 1.2 million cases, 350,000 cases will die from the diseases. This is done from different analysis and research studies which has been conducted by different researchers. Now, prostate cancer is the second leading cause of cancer death in men. Prostate cancer is the most common cancer cases occurring in men, and men are dying from it in a larger quantity, especially in an undeveloped country. Like in the advanced country, developed country, they start attacking it, and more research is on to bringing the effect down on the body. Okay, now out of every 8 men, a man will be affected with prostate cancer, and that is why you should screen yourself as early as possible. Now, out of 40 men diagnosed with prostate cancer, 1 of them will die from the disease. Okay, in order not to waste our time, others may become paralyzed from prostate cancer because it usually cuts the upper motor neuron from the lower motor neuron, okay, which will lead to lower extremity paralysis. So prostate cancer is a serious disease that should be treated virulently. You should report to the hospital as fast as possible. All right, average age of men who die from prostate cancer cases are 77. Men who die from prostate cancer die at the age of 77. So don't be scared, please. Don't be scared. Prostate cancer has nothing to do with you at 40, but at 40, 45, age 40, 45, and 50 upward, you must always check yourself, screen yourself at least once in 6 months, once in 12 months, depending on how and what you are feeling. If you are not having or you are not keeping a healthy sexual life, you must screen yourself as fast as possible. Screen yourself as soon as possible, once in a year, twice in a year, just to monitor the health of your prostate gland. Now, moving on to treatment. There are a series of treatments for prostate cancer. Now, the first one is radiotherapy. The second one is chemotherapy, surgical interventions, rehabilitation like having the Kegel exercise, prostatectomies, and other forms of treatment. Okay, I won't go deep into the treatment now. Watch out for my next video. I'll be talking about the treatment of prostate cancer in details. And the very last thing here is misconceptions attached to prostate cancer. There are several wrong beliefs about prostate cancer, which I'll be addressing in my next video. Misconceptions like, how often are you supposed to have sexual intercourse in order for you to reduce your risk of developing prostate cancer. Several people believe that you must be married to 4 wives, 10 wives, and then you must keep a healthy cycle of sexual intercourse on daily basis throughout the month for you to reduce for the risk to be reduced. No, that is unaccepted. But in my next class, I'm going to be going deeper into the misconceptions of prostate cancer. I will be looking at the treatment separately. I will also look at prostate gland itself, anatomical structure and physiological structure of the prostate gland. So please subscribe to my YouTube channel, and then so that you can be getting the notification as it drops in. Okay, thank you guys. Now let's get more of the music again. Okay. Woo!